meeting virtually. And there's a reason for that. Many of you attended our Health Scholar Showcase last month, and we were very fortunate to have Dr. Karriem Watson come and talk about All of Us as a program that has tremendous opportunities for us, not only as researchers, but as people working at a minority Hispanic serving institution. So as a follow-up to that, we heard a lot of feedback from the talk that Dr. Watson gave, asking how do we get involved? And we wanted to provide you with a more hands-on look at the All of Us Workbench and the opportunities to use data from this program and contribute to this program and participate in this program in a million ways. So we are thrilled today to have Ashley Green with us. She's Senior Research Projects Coordinator for All of Us program, and she is actually at Vanderbilt University Medical Center. It says Data and Research Center. Our new vice president for IT at Texas State is actually from Vanderbilt University Medical Center Data Center. So I don't know if you know him, Matt Hall, but it's a coincidence because I was just talking to him about Vanderbilt and my daughter went there or whatever. So yeah, so it is really great to have you and great to have all of you as participants in this event today. So we're going to just briefly introduce Ashley. Is it okay if I call you Ashley? Yeah, so I'm introducing Ashley, but I'm really going to turn it over to her because this is her meeting. And then we are recording, and I think Abby will be able to make it available to people that signed up if they weren't able to attend. So just so you know, it is being recorded, if that's okay with all of you. Ashley, take it away.
Oh, thank you so very much. Let me go ahead and share my screen. Okay, are you able to see my screen? Okay, perfect.
Yes.
Okay, so thank you so much for inviting me today. I am very excited to be here to talk about the All of Us research program. A few of my colleagues are here with me, so please feel free to drop any questions you have in the chat as we go along. We'll be able to have time at the end for questions, of course, but please feel free to drop them as you think of them. So today we're going to have a high level overall look at the research program and the workbench and see how to get started. So today we're going to learn about the program. We're going to take a peek at that data that we do offer. I'm going to show you the Research Hub as well as the data browser, which is a tool that you can use to instantly see the data types that we have and if we offer what you need. And then I'm also going to take you through the steps for registration. And then after that, we're going to see how to start a research project on the workbench. And then we will end it with some support materials that I have for you all to kind of get you started and to kind of show you where to go along the way as well. But first, we always like to take a moment to thank our participants who have very generously given their time and biomedical information to the program. None of the science that we hope to enable would be possible without them and their amazing contributions. And we're also very lucky to have a strong, diverse group of consortium partners who work tirelessly on promoting and supporting the program. So on the slide here, we have many partners working together with All of Us. We have the Participant Center as well as the HPO network, and both of these work with our participants to gather their data. I'm down here at the Data and Research Center, and Vanderbilt is the one that has like the main awardee, but we also work with many other institutions. What we do is we take the, and I'm going to go into more detail for you all, but we take the data that we get from our Participant Center and HPO networks, and we're the ones who make the data available for you all. And also, I do want to thank our wonderful consortium members who are working closely with us on the Nutrition for Precision Health. This has recently launched, and it really is a collaboration with all of the consortium in spreading the word and in growing the program. So you might have heard this with Dr. Watson earlier, but we are working toward advancing precision medicine for everyone at the All of Us research program. One of our aims is to have at least 1 million participants from across the United States. And we do truly value our participants. We see them as partners helping us and working with us to enable the science. You're going to hear me talk a lot about our partners and our participants. You're going to hear me talk about ways that we ensure their privacy as ways that we talk about transparency for them. So diversity is at the heart of the research program. Our data include a diverse population of participants, especially those who have been underrepresented in biomedical research. Now, our data are longitudinal, and that includes the surveys. So they really follow the participants during as they age and grow. And we have ways that you can see what the participants were like before they consented to the program, especially with our Fitbit data. So the data combine both biological and social determinants of health on a very large scale. And transparency is incredibly important to us because we really want our participants to know how their data are being used by the researchers. So the mission of the program is the acceleration of medical breakthroughs. We do have 3 objectives working toward that mission. We believe in creating and nurturing partnerships with our participants. And we're looking at delivering one of the largest biomedical data sets. What I love about this and our data set is that it is free to access and it is very secure. And we are working toward growing our community of researchers and providing ways that they can really enable their research as well as showcasing some of the work that they have done. So our data set is not only rich, it's also very diverse. The program aims to reflect the diversity of the country. 74% of our participants have at least one category of underrepresentation in biomedical research, and that is what the acronym UBR stands for on the slide. So out of this, we have data from over 400,000 participants, and of that data, 43% are of non-white race or Hispanic Latino ethnicity, 24% are over the age of 65, 9% have less than a GED education, 25% earn less than $25,000 a year, 10% are sexual and gender minorities, and 10% are living with a disability. So we've had a chance to learn more about the program and our participants. So now I'm going to show you all about the data. I'm going to show you how we curate the data and what we have available for you. So like I mentioned on the last slide, we have data from over 413,000 participants. And some of the data we offer includes surveys, electronic health records, physical measurements, wearables, and genomics. So let's take a peek at our genomic data. We are still in our beta phase. So that means that we currently have data from we have over 245,000 whole genome sequences. And we also have over 312,000 genotyping arrays. We also offer 1,000 long read sequences and over 11,000 structural variants. We do have Cromwell for the genomics data to help analyze it. And we offer different tiers of access to the data. And our genomics data are located in the control tier, which is the most restricted level of access that we offer. So I'm going to go into the different tiers that we have available in just a moment. But before that, we're still going to take a look at our data. Now taking a peek at our surveys, we offer 8 different surveys. And the first 3, the basics, overall health, and lifestyle, these surveys are required to be completed by all of our participants. After that, they're able to opt into the other surveys, as well as the other types of data that we offer. We also have the healthcare access and utilization survey, the personal health history and family medical history, social determinants of health. And we have 2 different surveys on COVID-19. We have the participant experience survey, also known as our COPE survey, and then we have our vaccine minutes survey. So we're going to take a closer look at the social determinants of health survey. This is one of our more recent surveys that we launched. And currently we have over 117,000 participants who have participated in this survey. This survey includes questions on food security, discrimination, neighborhood safety, social support, and more. And what's great about this particular survey is we had a lot of researchers who were asking for us to include social determinants of health. And so we listened to what we heard from our researchers. We added this survey, and we're still getting more feedback from our researchers on what they want to see. So we're adding more questions. We're going to be growing more of our surveys and adding more in the future. That's what I love about the program, is that we're constantly growing. We're constantly adding more types of data and more ways for researchers to access it. So our next one survey we're going to take a look at is the COPE survey. And with our COPE survey, this is the COVID-19 survey that we sent out to participants. We sent it out for several months in 2020 and 2021. What this survey does, specifically the COPE survey, it takes a look at the effects COVID had on mental health. And so we had more than 100,000 participants to respond to one or more of the 6 surveys we sent out. And we sent those surveys out between May of 2020 and March of 2021. So we launched those surveys really rather quickly after COVID was really taking hold of the globally. And also we added the minute survey. And so what the minute survey does is it asks participants about their vaccine status. So now you're able to have the COVID-19 vaccine status. You're able to look at the effects of mental health. And we also have that with COVID-19 with our EHR data as well. So now we're going to take a little look at our curation process. I mentioned just a tad bit of it at the beginning when we were looking at the participant centers at the beginning. And so what we do at the Data and Research Center, we take that raw data that we get from our HPO networks and our participant centers. And these data undergo quality control in our curation process to ensure participant privacy. And they're also harmonized. So these data are pushed through our pipeline about once a year on average. And when we do this, we use the OMOP data model. Now, our data are kept on a secure cloud-based platform on the Research Hub, and we use really high-level and high-quality security technology, very strict privacy and security protocols, because we really want to keep that participant data safe. And one of the other measures we use to ensure the privacy and security of our participants' data is that we also hire outside companies to try to hack into the server so that we're able to ensure that there is a high level of privacy and security for our participants. Okay, so we do have 3 different types of tiers of access to the data. We're going to start on this slide at the top, and then we're going to go down to the bottom and then going across to the right. So pretty much we're going to go from a broad level of access to a more controlled, restricted level of access. So taking a look at the public tier, the public tier is broad, and it is a summary of the data that we offer. Now this, in the public tier, we have aggregate data, and we do round up by 20. So anyone can look at this data by using our data browser on our public website. And I'm going to take you through the data browser so you can look at that public tier of access, and you can see quickly if we have the type of data that you need for your research projects. So our next tier is our registered tier. And this is where you must register with us to gain access to the data. So we first launched this in 2020. And this registered tier is where our participant level data live. So you must be registered, you must be approved to access it. And the way you will access it is through the researcher workbench. So in this level, what we have done in the registered tier is that we have removed all direct identifiers. We have also removed all free text data. We've obscured the date of health-related events. And also those dates are shifted backwards by a random number between 1 and 365. And that shift is constant for each record, so temporality of events is preserved. Our next tier is the control tier, and this is where you can find the genomic data. And in addition to the genomic data, more granular data from the registered tier are available. So what we have in the registered tier, you'll be able to access in the control tier, but you'll be able to get a more granular level of that data. So this includes having the first 3 digits of a participant zip code, because in the registered tier, we just have the state level, but control tier has the first 3 digits. You also have COVID-19 EHR data in the control tier, and you have unshifted dates. So we are a relatively young program. We've launched our first data available to the public to view in 2019. And then we made the participant level available for analysis in 2020. So each year we have been growing. We have been adding more data to our curated data set. And this has been a big part thanks to the feedback we have received from researchers. We try to improve the user experience, to add more tools to help you all out. Okay, so now that we've taken a look at the data, I'm going to show you the Research Hub. And this is the website that is home to both the public data that you can look at, that data browser that we talked about, and the public level data, as well as the registered tier of data. And we also have a lot of free tools that you can look at on the Research Hub. So there's a lot on the Research Hub. I can't go over everything today, but I will go over a lot with you all. I do encourage you to follow along with me if you'd like. Our website is researchallofus.org. So the Research Hub is a secure cloud-based Google platform, and it contains the public data available for anyone to view, as well as the controlled access data that requires registration to view and to analyze. So on the public portion, researchers can learn about the data and how we use it. You can also learn about the tools that we have available for you to analyze that data. And what's great about this is that participants can also use the Research Hub to see how their data are being used by the researchers, which is one of the ways that we maintain transparency. And the restricted access portion of the hub is on the researcher workbench. This requires a researcher to register to gain access. And this is where you can access that participant level data set that we saw earlier, as well as starting to analyze the data. So on the Research Hub, we offer a variety of unique ways to learn about the participants and to actually interact with the data. So the data snapshots page can be found under the Data and Tools tab, or you can access it directly from the main page. So this page gives you an overview of the aggregated public-facing data, and it is updated daily. So you're able to go into the snapshots page, and you're able to look at the participant demographics, the geographic distribution, and a lot more information about the participants themselves. It also provides a number of enrollment counts over time, so you can see how fast the program is growing and how fast we are getting toward enrolling 1 million participants. As of about, I think about an hour or so ago, we have over 793,000 participants. And the next thing I want to show you is the research project directory. So if you go to the Discover tab, it'll be at the very top, and this will list all of the current research projects researchers are conducting. So when a registered researcher begins a new workspace on the Workbench, they have to provide their project's research purpose, the description of the research, populations of interest that they're going to study, and more information. That information appears on the research project directory. It helps all of us to ensure the transparency of the type of research being conducted. We have close to 11,000 active research projects going on, and you're able to look based on the keyword, or you're able to go ahead and take a closer look and looking at you can search by the scientific question as well. So when you click on it, you're going to have more of the information to populate below. You're going to be able to see all of the information that the researcher provided about their research projects. And you can also see who owns that project, as well as the team members on the project. The next part of the hub I want to take you to is also under the Discover tab, and this is the publications page. So the publications page lists peer-reviewed articles that all of us researchers have published. This page includes the links to the articles. So we require researchers to alert us when they are publishing their manuscripts. We require them to let us know about 2 weeks before publication, or even earlier, but a minimum of 2 weeks. We like to list them here to celebrate their amazing work, and it is another way that participants can see how their data are being used. So if you want to see all the manuscripts that have been published using all of this data, this is where you want to go. On one of our future publications we have is a huge paper that we did all on the genomic data in the All of Us research program. It was recently published in Nature. So if you're interested in genomic data and the genomic data that we have in the program, this is a fun read to have. So currently we have 320 publications, and I looked at the publications page about 2 weeks ago, and we have added close to 20 publications in the past 2 weeks. So our researchers are very active and getting their research out there, which is really amazing to think about since the data was available in 2020. So our researchers are very active. So far we've taken a look at the program, the data we have. Now I'm going to take you to one of my favorite parts of the Research Hub. I'm going to take you to the data browser. And what's great about this is it is a way for you to see if we have what you need. So with the data browser, one of my favorite places to go to, the data browser is located under the Data and Tools tab. We have a lot of great information for you under the Data and Tools tab. So if you have a moment later on, please take some time to play around, because there's a lot going on under this tab. But with the data browser, it does provide interactive views of the publicly available participant data. And so anybody can learn about the data types as well as the quantity of data that we collect. So this is where the aggregate data are located. If you think back to the slide where we have the different tiers of data, this is the top tier, the public tier, that's open for anybody. But when you come here, you're going to notice that the data are rounded up to counts of 20. We do this to protect our participants' privacy. You can also explore the aggregate data. We have the electronic health record information, survey responses, physical measurements, and wearables data. This data is not updated daily. It's updated about once a year on average when the data are pushed through the curation pipeline that we saw earlier. And you can use the search tool at the top to examine topics of interest, and the results will be automatically generated below. And so it will show you all of the different data types we have available related to your topic. So it really is a great way to see if we have what you need and if the research you want to do is feasible with the data. So I'm going to take you through the data browser so you can kind of see what it looks like. So if you come to the data browser and you type in what you're interested in, for me, I'm interested in studying asthma. So I would type in asthma at the top. And when I do that, all of the data that contains information about asthma will be populated below. So for asthma, I now have 2 EHR domains as well as some survey questions. So I'm going to take a closer look at what's available in the conditions EHR domain. And I will do that by clicking on the conditions, or pretty much anywhere on the box. And when I do that, it takes me to a page that has all of the matching medical concepts related to asthma conditions. So from here, I can see the top 10 conditions in the bar graph of participant count for that top 10. Below the graph are the counts of the matching medical concepts. So each one has the name of the condition, the participant count, and the percentage of participants. And then if I want to take an even closer look, what I can do is I could come down to conditions, I can click on asthma, and I'm going to get more information about the participants. So now I can examine the participants who have asthma in their EHR. I can look at their sex assigned at birth, I can see their age, and I can also see the sources. So the sources are the SNOMED code as well as the OMOP concept ID. And the other tool I want to show you is the Survey Explorer. It lives under the Data and Tools tab as well. And here you can examine all of the questions that have been asked to participants, as well as the answer options. Now, with this survey, the surveys are in both English as well as Spanish. And if you're interested in seeing what we have and what we're going to have coming down the pipeline in the future, we do have a data roadmap for you to view. You can find it under the Data and Tools tab when you click on Data Sources. And this offers our projects with general dates for data release in the future. It doesn't have the exact dates of our planned launches, but it does show you the data that we do have planned. So if you go to the data browser and you don't see what you need, and if you go to the roadmap and you don't see what you need, please let us know, because we love taking the suggestions that we get from our researchers and working to incorporate that. We do keep a record of everything that we received, and we try our best to have that data available for our researchers. So if you're ready to go ahead and to register, I'm going to take you through the steps so you can gain access to the data. You can apply for access and register by clicking on the register button at the top of the Research Hub. There are 4 steps to complete. And within each step, there are links to valuable bits of information, as well as help guides to help you all out along as you go through the process. So I'm going to take you through a closer look at each step. With step 1, you must be affiliated with an institution that has a data use and registration agreement with us. Texas State University does, so you're all set with step 1. And if you want to see the other institutions that have an agreement in place with us, you can click on that link. I'm actually going to show that to you in a moment, because it's a great way to see if other people you want to work with, how they can get registered as well. So with step 2, once you have checked your institution, you will register by creating an account, and you will also verify your identity with either id.me or login.gov. And with step 3, you will complete the code of conduct training. And then at step 4, you will sign the data user code of conduct. Many people have described the conduct training as sort of like the city training, if you're familiar with that, if you've gone through that process. So it's a lot like that. With ours, it typically takes about 2 hours to complete. My city training took me a lot more than 2 hours. So luckily with ours, it's about 2 hours to do that. And what's great is that you can stop and go at your own pace, or you can do it all at once if you want to. So I'm going to take us back to step 1. We're going to look at all of the institutions that have ADURA in place with us. So ADURA means a data use and registration agreement. The reason why I wanted to show you this is we do believe in team science. We're big, huge proponents of that. So you are welcome to create a research project and share it with others, as long as they are registered with us. So maybe you know somebody you want to work with. They need to be sure that they're affiliated with a registered institution. Texas State University is, and you have both the registered tier as well as the controlled tier access. You've got all the good stuff ready to go. We currently have, we're getting close to 800 institutions with an agreement in place with us. So If you want to work with somebody else outside of TSU, you can show them how they can see if their institution is in place. And what's great about registering with this is that we do have a lot of benefits to help you out. We have a lot of tools and resources. We do offer $300 in free credits. So what that means is, yes, it's free to register, it's free to look at the data and to access it. The money comes in when you have to analyze the data. You pull the data from the cloud. This comes from Google, doesn't come from us at Vanderbilt, and is also used to store the data. So we do give you $300 to help you out. And we do have a lot of support tools to help you know how much it might cost, how to get started with that. Our support team is available to help you answer any questions you have, from very basic to very detailed, including any coding questions you may have. Our support team is out of Vanderbilt, and they are real humans and not bots. So you'll be able to ask any of your questions, and we respond during the typical business days. And we do love celebrating our researchers. We love giving them a platform so that they can share their work on webinars. This is using all of us as a way for you to help your research. You can use it to work with if you have a dissertation, or if you're working with someone on their dissertation, you can use it for poster presentations, class projects. If you are leading a class and you want your students to use all of us, this is a tool that you can incorporate into your own classroom. Okay, so now that we've taken a look at all of the public facing stuff, we are now going to look and see how to get started with a workspace. So the Workbench is where the restricted participant level data live. All research or Workbench analyses happen within a workspace, and a workspace is your place to store and analyze that data for a specific project. So after you have completed registration and you've received your information and you've gained access, you're going to receive that login information in an email. The email is actually going to have a lot of information, so you might want to hold on to it. But once you get your information to log in, you will click on the researcher login button on the Research Hub, and then you will sign in with Google. So the Workbench is where you will create that research by creating a workspace. You will build and analyze your data sets. We have a lot of point and click tools to help get you started with that. So in a workspace, you can select the participants based on specific criteria using the cohort builder tool. Another tool is the dataset builder, and this allows you to select those variables and values of interest that you are interested in researching in your cohort, in your participants. You can then save and export your data set to a notebook to begin analysis. And like I mentioned earlier, our workspaces are set up to be very collaborative. So you can share with your research team. They could be at your institution or at a different one, but everybody must be registered with us. So what's really great about this is maybe you have that research project in mind or the scientific question in mind, but maybe you're not familiar with the coding needed to run the analysis. Well, you can add a team member to your workspace and they can help run that analysis for you. And we use a passport model. So this means that we approve the user, and you don't have to have a research project in mind when you first register. This all means that you do not have to gain IRB approval from us first. So what you do with the passport model is that because we don't have the IRB approval and we don't approve each individual project one at a time, we do ask for you to be very detailed in your description of your research each time you create a workspace, even if you're just using it to explore the data. When you fill out this information, it will go to the project directory we saw earlier. We also do not limit how many researchers can be working on a topic, so there may be several others who are researching the exact same research as you are. Okay, so let's get started on what it looks like to start a workspace. When you log in, the landing page will show you the workspaces you've created, as well as those that have been shared with you. So on our slide right here, this is my landing page, and I have all the workspaces I've been working on. I have my recently accessed items, and we do also offer videos of quick tutorials to help you out along the way. So to begin, you're going to click on the plus sign at the top. And when you do, you'll be taken to this page where you'll be asked to fill in all of these different parts. We ask you to be very detailed with this. The banners next to each field will denote if it's going to be available on and viewable on the research project directory. And what's great with this is that you can edit this anytime. So sometimes your project might start in one direction and then you want to change it to a different direction. You can come in here and you can edit it as you go along. And once you have done that, you will be taken to your data tab. And the data tab is where you can access our point and click tools and to begin your research. So this includes the cohort builder for selecting participants to include in your data set, and the data set tool for selecting the variables and values of interest you want to research in your cohort to be used in the data set. And off to the side, we have Cromwell, RStudio, SAS, and Jupyter that you can use for your analysis when you get to that stage. RStudio and SAS just launched like within the past couple of weeks, so you are seeing the fresh new analysis tools that we have. And so when you click on each one, you'll be able to see how much it's going to cost to analyze it and to run it. It'll also give you tools at the bottom for, they'll take you to our support hub to help you out, but I'm going to give you a more detailed look at that here in a moment. So when you are ready to start, you will click on the plus sign, and I'm going to show you what it looks like on my end when I got started with my cohort. So these are the participants I'm interested in studying. For my project on asthma, I have included participants over the age of 25, and I have also included in the second part the criteria for having the condition of asthma. And as you do this, you can add more to this, and which is a great idea to make it as small of a cohort as possible. That's one of the ways to help keep the price down. And as you do this, you can see your participant count off to the side will populate as you add more. You can also exclude participants you don't want to have included. And once you have done that, once you've drilled it down, you will save your cohort, and then you'll be taken to your data set builder. So the data set builder is where you can choose the variables and those concepts you wish to study within your participant cohort. So the concepts describe information in a patient's medical records, such as a condition they have, a prescription they are taking, or their physical measurements. So with my data set, I can come back and I can choose the participant cohort that I've created, and then I can select those concepts I wish to study. And when you do that, you'll be able to preview it. I'm not going to include the preview down here at the bottom to protect our participants' privacy, but you'll be able to see that as you create this. And then once you do that, you'll be able to save your data set. You will export it to our cloud applications to begin analysis. So the cloud application is where you can use human readable language and code to narrate your analyses. I like to think of this as my lab notebook. And so currently we have only Python, R, SAS, and RStudio coding language that can be used. We do offer Hell and Plink for the genomic data. And we do have plans on adding more analysis programs in the future, thanks to the feedback we have received from our researchers. One thing I want to stress and to let you all know is that you are not able to download the data and you cannot take it off the cloud. The data must stay in the cloud. We do this to ensure our participants' privacy. So I've given you a very high-level overview of the platform and the tools, and now I'm going to show you ways that you can use those tools to help you out along the way. So when you're in your workspace and you click on the hamburger symbol, you'll notice because we use Google Cloud that there are a lot of, if you're familiar with some of the Google, the way it looks on like a Google Drive, you'll be familiar with how some of the things work as well. So when you click on that hamburger menu, you can click on the featured workspaces. And this is where you can look at some of our tutorial workspaces that we have created for you. These workspaces offer example notebooks on how to work with the data. And what's really great about them is that you can duplicate them. And you can duplicate them and add them to your own workspace. You can edit them. It gives you a really good chance to have a hands-on experience with the data as well. And we have an amazing support team. They're very responsive. They do offer new user orientation each month, as well as weekly office hours to help answer any questions you may have. The office hours, we have them weekly on Tuesdays and bi-weekly on Fridays. The Tuesday office hours, well, all office hours as well as new user orientation are done at 1 p.m. Central Time. And the Tuesday office hours, they're open Q&A. These office hours on Tuesdays are just for registered users. We have it set up that way because we allow researchers to share their screen so that we can look at the coding that they're working on, if they want to share that, if that's part of their question. And we can go into very detailed questions. We can go into very high level questions. So it's a great way to get an exact answer from our team of experts, and they can help guide you through it, or they can start an investigation to see if maybe you're encountering an issue that hasn't come up before. On our Friday office hours, they are bi-weekly. These are thematic in nature, so they're open to anybody. Anybody can participate. We record these and put them up on our support hub. Recently, we had one for our studio. We've had another one for SAS. So if you're not able to make it, you will be able to have a chance to view it later on. And we do have a really great support hub. Our support hub offers a comprehensive set of resources to help you with your projects. So in the user support hub, you're going to be able to find articles and resources to help guide you. We have pages dedicated just to SAS, one just to our studio. These include the videos that we've created, as well as the articles that have been created. And at the top is kind of like the data browser where you can search for any topics. We do have some of the ones that are requested the most or get searched for the most, like our data dictionary and our office hours, as well as billing. And data wrangling has been a highly requested topic. So we've created a workspace on how to do data wrangling, as well as a video. That was one of our office hours a couple of months ago. So you're able to see that video. And below here on the user support hub, we have a calendar of events, so you can see the upcoming new user orientations, Friday office hours, as well as other events that our consortium partners are putting on. And we do have a quarterly newsletter, so you can keep up to date with all of the data launches that are coming out. You're welcome to use our QR code or our website or our little link that we have. You're also able to find it at the bottom of the Research Hub under the Help button. So I've given you a lot of information in a very short amount of time. So I hope that helps you with your research. Please let us know if you have any questions. You can reach out to us. I'm going to put the link in the chat. Oh, Danielle, one of my colleagues, Danielle, has been helping out. She's got the link for the user support hub as well as the user support team. You can contact us at any time. We'll be happy to help you with answering any questions you may have. So I'll go ahead and stop sharing. So if you have any questions that maybe have not been answered, or you think of any, I'm happy to answer any of those questions now. So please feel free to raise your hand, or if you want to put them in the chat, or if I've missed anything, please let me know.
Hey, Ashley, I had a question. It's my understanding that the average cost of like a study and analysis is usually, unless it's something, very specific genomic data, it's under $50. Is that generally true?
Yes, generally, yes. For me, my research project's actually the one that I created for today. After I analyzed it, it was a little under $4. So, yes, you can keep them. They can be really cheap. However, like you mentioned, the genomics can be a little expensive. We do offer ways to drill down the participant cohort and those information that I was sharing that can that is a great way of keeping the price tag down. Danielle has put in the chat this amazing article that really helps you to know how much is it going to cost, how you can keep the price down. We also have on the support hub a video of specifically about billing and about cost and how to keep the price tag down. And yes, it is $300 in initial credits. So
And
that the $300 can go a long way. I still have mine from when I started up like a few years ago. So we do give you a lot of ways to keep that price down.
And my second question is, in the event somebody was doing something really sophisticated or doing a lot of things, which I hope everybody that's in this meeting will, and they run out of their $300, as an institution, can we deposit into our researchers' accounts individually?
Yes, we do have a way of on our billing platform, our billing articles, it'll show you how you can set that up, as well as a billing video to set you up as well. Something to note about where the price comes from, or where the cost comes from, I should say. Whoever is the owner of the project, that's where the money comes from. So the owner of the project, that's where you want to put the money because the money comes from the owner, even if there are multiple people on the project.
Sure, that makes sense.
Mhm.
But it seems to me that having the data in the cloud in this very protected space, that helps maybe streamline some problems that might happen with IRB, and so the cost actually has a benefit too, that you can do the project because you have a way to protect your data and store it.
Yes, and NIH will occasionally have ways to get more funding. They'll pop up, and it's not so much all of us specifically, but NIH generally will have some topics that'll pop up for researchers as well. They have a website that will list all of those different opportunities that will come up.
Thank you.
Mhm.
Does
But yeah,
anyone
this
else have
is
a
a great
question?
question. Oh, thank you, Danielle.
How to watch in the chat.
Ashley, it looks like we have a question in the Q&A from Emily Zhu. In case we use all of us data for publication, is it necessary that all co-authors are registered researchers? Or is it sufficient that only authors doing data analysis are registered?
Oh, that is a great question. Those who are looking at the data, the participant level data, and analyzing the participant level data, anybody who looks at the participant level, they have to be registered. But if you do have more questions about that, we have an amazing policy team. You can email us and we can give you, we'll be able to give you very detailed answers. And we do have, you'll be able to, when you go through the training, you'll go through the policies and what it takes to get published as well.
Anyone else? Well, I am grateful to you for going through this with us, and it's perfect timing because it's the end of the semester, and for the summer, what a great thing to have the time to kind of look around in this workbench and see all of the data and the opportunities and the projects and the collaborators that you could potentially want to be involved with. And so I really encourage you to pursue something using all of us this summer, even if it's just small, just so that you can learn more about it. I think there's a question.
Oh, yes, Maria had her hand up.
Oh, I didn't see. Sorry, Maria.
Oh, yeah, that's okay. Sorry, it was like last minute. I think this is great. I was really excited to see the different options with the Workbench, with using Jupyter Notebooks or RStudio or SAS. I was just wondering, is that basically going to be through a Google Colab type environment or
That
so
is
like
an excellent question. With it, we do have like Google buckets to help with storage with it. So it is partially Google, but if you reach out to the support team, they'll be able to give you a more detailed question about the environment.
okay, cool, very cool.
Mhm.
Thank you.
Yeah.
For those of you that are less familiar with SAS, I saw on the Workbench also, there's really great, it has all of the prompts and things for anything that shows you exactly how to run analyses in the different programs that they have available. So it's really very, very simple and straightforward.
That is a good question too. So for us, about the IRB, you need to check with your institution to see what their policy is for IRB, but with us, you don't have to gain IRB approval for us, but your institution may have their own policy when it comes to that. So we recommend you reaching out to them and seeing what their status is with that. But to get registered to start a project with us, we don't require IRB approval.
Okay, thanks, Ashley. Yeah, that's something maybe we could check on to know for Texas State. So those of us that might want to use it, we kind of know. And I also know some journals really want that as part of the process here. So it looks like Amy's already on it. Thanks, Dr. Roundtree.
Ty, are you on the call still? We do have a couple of researchers that have used it already, and I was wondering about if they had any insights, but we can check with IRB, or I'm sure Amy already probably did and like solve this for us. So we can follow up on that for you.
I have a quick question.
Hey, yes.
Marsha, I think you're cutting out. We can't hear you.
Oh, is this better?
Yes.
Hello?
Yeah.
The microphone solves everything. My apologies for that. I was looking through the links that you all provided. I'm big on resources and big on looking at events. And I see that y'all have some like drop-in office hours. You have coffee events where you speak on specific topics, as well as scheduled office hours. Is that something that if we are not registered just yet, but we're wanting to, we're looking and thinking about things, are we able to get access to those events if we sign up, or is that something where we need to be registered and looking? Because I see a few of these, I'm like, I'm very interested in these, but I'm not necessarily on the let me be the researcher side of things. So that was just a quick question.
Yeah, that's an excellent question. The Tuesday office hours that we offer each week are only for registered users, but the other office hours, the Friday office hours and the new user orientation office hours, are open for everybody.
Okay.
In fact, we have all of the Friday office hours are recorded and they're posted to our platform. So if you want to look at what's been done in the past, you can look at those. You can look at some of the new user orientations that we've done. And yeah, you're able to do those. The Tuesday ones, not because the researchers can share their screen, and we want to protect our participant privacy. But they'll give you a little message at the beginning to generally for people, hey, this is just for research, for registered people. So yeah.
Okay. Excellent.
But yes, we have a lot for those who are not registered yet.
Okay. Thank you so much. I really appreciate that.
No problem. It's kind of like shopping for a car.
Yeah, hi. And I would just like to add to that. So many of the events that you see on that event calendar are the DRCs, but some of them are our partners, other people who are in the consortium, so they aren't ours. So for example, that coffee one is run by Ignite, and then there are some that are run from Baylor College of Medicine, and they will have their own rules in terms of who can attend.
Okay, good to know. Thank you very much.
Before we wrap up, there was one more thing that I wanted to kind of touch on, which is not only is all of us a great opportunity for researchers looking for data, but the data itself is a great opportunity to diversify knowledge that we have about health And I really think that Texas State could be a wonderful place to increase the number of participants in this data set. Since we have such a diverse student population and our students come from most every county in the state of Texas, that would just be such a good thing to add into your course materials, or if you're teaching a methods class, to kind of introduce this as a way to tell your story and to be counted when people are talking about health disparities and a lack of data on certain populations and certain topics. This is a place to securely log in. And in fact, my whole family is in the participant data pool for all of us because of, we just were very interested in it, and my kids were learning stats. And so we just thought, as they got older, we all ended up already enrolling. And so I would, encourage you to either enroll yourself and or make this part of a lecture so that students can learn about how, if there's a discussion around health disparities and a lack of data, to fully understand populations and conditions. If there's an opportunity to be part of a solution by joining this, I think that's something that you can make available to your students. That'd be great.
And I'm actually also going to put in the chat a link to an article that we have. We actually had a professor from Townsend University who worked with her students. She puts the workbench in her classroom every semester, and she has created an article for educators on how to incorporate that. It's based on an undergrad level, and she and her TA created a workspace as well. So you've got that link to kind of help get you started. Oh, yes, we've got one more. We've got a hand raised. Yes.
Hi, Ashley. Thank you again. This is a wonderful opportunity. I was honing in a little bit on the first thing you kind of mentioned around genomics.
Mm-hmm.
That's kind of a personal area that I play around in. Do y'all tie in, and maybe I missed this, but do y'all tie in all of the national and global databases, like through CDC, through different departments of health, through WHO, things like that, to kind of collate that data, or is it collected elsewhere?
Currently, no, it's just us. We have our genomic data set, data partners. We have the University of Washington is one, and Danielle, do you remember the other one, the genomic partner? I could tell you any other day, but
it's okay. I was just curious, because there are some other massive databases out there that collate data. I was just curious if y'all are tied in together.
Not yet, no.
Okay.
But we've had a lot of researchers asking us that question, but currently not yet, but who knows about what the future may hold.
You can import data into the researcher workbench. So if you have data that you would like to import, as long as it complies with our data policy, you can import it.
Okay, thank you.
Anyone else? Okay, well, we're just about out of time. So I just want to thank you all again for joining us. I know it's a busy time during the semester, but I hope this has been valuable for you, and I hope that you will register. If you have questions, you can certainly call me or others that are on the workbench, and we can try to help you. It is a little bit time consuming to get registered, I will say that. And just, there's a lot of steps, but that's all speaking to the security of the data and the importance of security for this platform. So I'm all for it. As difficult as it was, I would definitely say that I think it's really great that they're doing such a good job of collecting data and keeping it safe and then making it accessible all at the same time. So thank you for that. And thank you so much for joining us today, Ashley and Danielle and the all of us team. We were so excited after we heard Dr. Watson's talk, and this has really helped to fill in the gaps of what, the next steps. And if you're interested in doing a project with all of us and you need any kind of support, please do reach back to THRC. We're happy to help you in any way that we can. So have a great afternoon. Thank you.
Thanks.
Hey, Dr.